What's up, guys? I'm going to cut straight to the chase. What caused Rich Piana's death? And plain and simple, it's a vascular injury or event, you guys. This isn't going to be publicly reported to you guys. The family's keeping everything under wraps. And the conclusive autopsy report will not happen if they even do an autopsy, and his particular autopsy would be very complicated, where the family would actually have to request specific things to be looked at outside of the norm of what an autopsy usually covers. So simply for the fact that Rich was basically a freak and a science experiment, and there was a lot going on in his body that a doctor would not be aware of without prior knowledge. So a vascular event, you guys. That morning when he passed out, as Chanel was cutting his hair, he basically had either a heart attack or a stroke or an aneurysm or an embolism, or honestly a combination of any or all of those things, because he basically dropped dead. Honestly, he was basically dead when he hit the floor, you guys. Brain death occurs within just minutes of lack of oxygen to the brain. Chanel had pointed out that it was at least 10 minutes before the paramedics arrived. His heart stopped at that point as well. So he suffered an unrecoverable injury at that point, that no matter what, that he was not going to recover, you guys. So to go over some of the details as to why that happened, you guys, it's a conglomerate of variables and factors when it comes to Rich's situation as to why that happened. The first thing that everybody says, including TMZ and all the sensationalist, uneducated, unintelligent, uninformed individuals who see a gigantic bodybuilder, right away they say it's anabolics. And incorrect, wrong. Unfortunately, it's a lot more complicated than that, but most people are real simple and they want a simple answer. And like, he drank too much, he crashed his car into a tree. He died because of anabolics. It's just not that simple, you guys. So I'm going to go over a lot of the actual factors as to why Rich ultimately passed away, because he was actually a ticking time bomb and potentially didn't know it. I mean, he went to the doctor recently and he had all his blood work and things checked out, and things weren't so hot. So he wanted to drop weight. So I think in some ways he was aware of the fact that he was a ticking time bomb. And he expired sooner than he thought, which sucks, you guys, because I was a fan. In any case, you guys, he had extensive vascular damage. He had massive vascular damage in terms of his veins, his arteries, and his actual heart. One of the things that you can determine that is just simply by looking at his veins. He had bulging veins. Now, that's not a layman's term, that's actual clinical term. Bulging veins are oversized veins in which the blood flow is poor due to the fact that the flaps and the valves inside the veins don't work properly. So a nice vein or artery will have the flaps like this and they'll open as blood flows, and a bulging enlarged vein doesn't have the connection in the flaps and blood just pools. Circulation is screwed up. It's a big old mess. You can see Rich's bulging veins even at rest in his arms and in his chest. Clearly he had oversized veins, looked like at least 3 times normal, which that would have already been a sign of vascular damage, severe damage to his veins and arteries. That's just by visual inspection. So so basically the hydraulics, the flow of blood, is all screwed up in his body. And TMZ reported that the paramedics found crushed white powder, a credit card, and a straw on a table in his house, and they administered 2 doses of Narcan to counteract what they thought was an opiate overdose, which normally results in a depressed respiration, and Narcan counteracts that depressed respiration, gets a person breathing again. But for anyone that knows Rich, he wasn't into really opiates. He was into stimulants. And Chanel said that he snorted pre-workouts because he was unconventional, and that's what was found as a pre-workout powder that he snorted earlier that day, which Chanel's video this morning was really touching and heartfelt. Chanel is a really caring individual, and she knows how to say things in a heartfelt manner, and I feel for her during this time. So, but this is one area that she's not truthful about. I'll tell you what I think it was in a second. What did Rich admit to using outside of anabolics? He admitted to obviously using pre-workouts all the time. He admitted to using Adderall, cocaine, and other narcotics, specifically with his ex-wife, Sarah. And, you know, Sarah was obviously a drug addict from Europe who came in to find a rich guy and to party. And Rich loved her and wanted to make her happy, and they had some good times, which included drugs. And now, would Rich be still using cocaine and things like that? Most likely not. His drug of choice was Adderall. So chances are that crushed white powder is probably Adderall, because he was all about being productive and getting things done. And I doubt it was a pre-workout, because pre-workouts have sugar and other additives. I don't think you'd want to snort all the other junk that comes in a pre-workout and so on. And again, pre-workouts are usually pretty colorful and not white. Adderall is white, also comes in a few other colors as well, but chances are it was Adderall, folks. But that's not the reason why he died. That's not the reason why he passed out. Rich, at 46 years old, is a veteran polypharmacist, meaning he knows how to use drugs, from the anabolics to the Adderalls and all of the miscellaneous medications that come along with that. He's a seasoned individual as far as how to use these medications and these drugs and how they affect his body. So would he be stupid enough to overdose on Adderall, which there's just my personal opinion, absolutely not. It was not an overdose. What happened there, again, Rich was a ticking time bomb. There was all of these variables and factors that contributed to his ultimate demise that day. Some of the other factors that played into this are admitted by Chanel. Chanel said that he had difficulty breathing, and that he most likely had sleep apnea, which from what it sounds like they never medically diagnosed, but he obviously had difficulty with his breathing when he slept, which was confirmed by Chanel. Sleep apnea is basically a state of poor blood flow and oxygenation to the heart because the person literally stops breathing. So someone who has vascular damage and cardiac damage, this would just be further aggravation of that damage. Anyone that has sleep apnea has an increased risk of heart failure and a stroke, again, which would be a vascular injury. If you are a fan of Rich and you watched his videos, you would have seen that he has a lot of labored breathing in these videos. When he spoke, he almost was wheezing a lot of times, especially when he was doing Bigger by the Day and he was around 300 pounds. He was wheezing and having actually a very difficult time breathing, which is just another indicator of ill health. I mean, that excessive body weight, that body mass index, and being around 300 pounds just contributes to that poor state of health, that additional variable and factor that would ultimately lead him to have a vascular event. Ric Drasin, for those of you that know who he is, he speculated that Rich had an enlarged heart. Now, every athlete that exercises has an enlarged heart. Even pregnant women have an enlarged heart in terms of having their left ventricle thickened and enlarged in that sense, but not a clinically enlarged heart, which is different than a thickened left ventricle. A clinically enlarged heart is cardiomegaly, where the entire heart is physically larger in size and is actually weakened and at a very high risk for failure and a heart attack. I don't think Rich at 46 had cardiomegaly, clinically enlarged heart. Guaranteed he had a thickened left ventricle, just like every athlete. Teenage, young and old, anyone who exercises has a thickened left ventricle, which is a normal response to exercise. And there's no adverse, long-term ill effects of having a thickened left ventricle. It's basically like your muscles getting bigger from exercise. The left ventricle gets stronger to pump harder the blood through the body. So that's another one that's wrong. Anabolics, of course, do cause cardiomegaly, and but that's something that happens almost right away, right from the beginning of use of anabolics. So Rich, if he had a clinically enlarged heart, he would have been dead in his teens from an enlarged heart, because this is a very common, documented phenomenon in males who are young, in late teens, early 20s, who begin using anabolics, and immediately, because they are susceptible to enlarged heart, they pass away almost immediately from a heart attack or a stroke. They don't last. I mean, it's an instant kind of a thing. There are exceptions to that rule, but for the sake of this video and Rich's condition, he did not have an enlarged heart, a clinically enlarged heart. And anabolics had nothing to do with that in terms of Rich. Then we get to one of the hallmarks of Rich, and that was his gigantic shoulders, biceps, triceps, forearms, and even chest. Now, he had, based on an ex, admitted that he had Pmma injections, which are polymethyl methacrylate. It's basically an injected implant, if you will. How women get breast implants. Pmma is used for various reasons in medicine, and I think one of the ways Rich got probably involved with it is because they actually use it to inject male gonads, if you will, because it's used for penile enlargement and enhancement in Europe and other countries. I don't think that's approved here in the USA. May very well be, but maybe he heard about it in that way, that it's used, you know, for penile enlargement, so that, hey, you could use it for your muscles. It's used for various other reasons as well. The reason for that is it's because it's an inert polymer. It's basically a plastic. It's a clear liquid plastic, and once it's injected into an area, it expands and hardens, and kind of like cement, it sets. So they call it a biocement. And Rich, again, from a visual inspection of looking at him, he probably had several pounds of Pmma injected all over his shoulders, his biceps, triceps, including his chest, as well as his forearms. It's pretty distinct and obvious. I mean, a gigantic amount. I think he's probably he should be studied for what exactly happens to a human being when they have several pounds of Pmma injected into them, because in medical terms, no one has ever used that much Pmma in a human being for any purposes of any kind for medical treatment, not even for penile enlargement and for the use in terms of bone repair and so forth, because it is used for bone repair and so on. I don't think any human being has ever been subjected to that much Pmma in the history of history. So for sheer science, his body should be studied as to what exactly resulted from his Pmma injections. Now, why do I bring up the Pmma? Because there have been a lot of studies done and a lot of research and a lot of science done on Pmma. I honestly, based on this research, I don't know why they would even use this for any purposes, but long-term effects basically of Pmma are that it leaks into the vascular tissue. It leaks once, for example, it's injected, let's say, into Rich's shoulder. Before it completely sets, that liquid will get absorbed through the veins and arteries, and it will get dispersed through every single organ. And it's been found with individuals that have been treated with Pmma to have actual plastic all throughout their veins and arteries and all organs. We're talking about the heart, the lungs, the kidneys, the liver, the brain. All organs, all areas of the vascular tissue have had large deposits of this liquid plastic all over it. Now, what does large deposits of liquid plastic do to a person? An embolism, a blockage basically, because it's a plastic substance that shouldn't be there, impeding blood flow in the arteries and the veins, and obviously impeding blood flow in all of the organs. And that can cause a heart attack, a stroke, an aneurysm, and so on, and again, contribute and be a real big factor in Rich's actual ultimate demise as to why he had a vascular event. Now, is it the sole cause of his injury and so why he passed away? No, but certainly a cause, a factor. His large body size, his poor diet, his bulging veins, and clearly very inflamed veins and arteries and heart, and a lifestyle of basically running his body too hard for too many years is what basically caused him to die. It wasn't the anabolics, folks. The anabolics, we would definitely put in the list of variables, but it would probably be at the very bottom of the list, folks, because if you know anything about death of individuals from anabolics, it's generally not the core reason for a person's death, and it certainly, in my opinion, isn't the reason why he passed away as well. I could go on and on more about PMMA, you guys, and tell you guys more about the side effects and things like that, but I think that's just beyond the scope of this video. So I hope you guys understand that it is a plethora of variables that played a big part in Rich's death. I mean, it was very clear that he had continuous skin cancer recurrences, and again, all of the labored breathing, his very high body mass. Add to that stimulants and Adderall and so on, all of those variables together, folks. It wasn't one little thing. It's that whole group of variables that played that part. So those of you wanting that simple answer, you're not going to get one, because it's just not that simple. You know, personally, I think if Rich ate a better diet, it would have helped contribute to better vascular health, but I don't think that would have changed anything other than possibly gave him a little more time, because his lifestyle and the way he did treat his body is what ultimately led him to pass away. And it's really sad, you guys. You know, on a side note, TMZ reported this in a sensational way. TMZ is never to be seen when it comes to bodybuilding and fitness, and here all of a sudden when Dallas McCarver passed away and Rich passes away, the media, they go out there, anabolics, another bodybuilder passes away due to the craziness of the sport, and so on and so forth. You never see TMZ otherwise. Never do they report anything on bodybuilding in any way. So here they are, crawling out of the woodwork, crawling out of the gutter, sensationalizing a tragedy ×2, Dallas and Rich. And my personal opinion, TMZ, you're pond scum. Sensationalizing and looking to profiteer off of tragedies in bodybuilding and fitness. You guys, even when you interviewed Ronnie Coleman, you guys were pretty heartless and disgusting. And I personally will not be watching TMZ, and if I was you guys, I would encourage you to not watch TMZ either, because I don't think they deserve the eyeballs for their just despicable way of reporting on the death of Rich Piana and Dallas McCarver. Chanel, I think, was Rich's true love, and I'm honestly thankful and happy that Chanel was there for Rich by his side. I think she's an amazing individual and certainly was one of the most wonderful aspects of Rich's life in making him happy and bringing him happiness. So kudos to you, Chanel. You were a godsend for Rich, and I know he appreciated you. And on that note, you guys, I'm not going to waste any more time. And I'll just leave it at the fact that how Rich used to always leave his videos is always stay positive. Do the best for yourself. Set yourself goals. Enjoy life. Don't be negative. Peace.